Endometrial cancer begins in the uterus lining, called the endometrium. This video uses simple 3D animation to show how it starts and how to spot early signs. Lead with symptoms. Stay calm. The most common symptom is unusual bleeding. After menopause, any bleeding is a warning to call your doctor. You may notice spotting, or heavier periods than usual. Pelvic pain can happen. Pain during sex can happen. Some people report unusual discharge. These signs often have other causes, but they should prompt a visit. Early attention keeps options open. Bleeding after menopause is not rare. Many causes are benign, like polyps or hormonal shifts. Still, any postmenopausal bleeding should be checked. Call your clinic and schedule soon. Your care team will guide next steps clearly and calmly. Section 2. Anatomy. The uterus is a small pear-shaped organ in the pelvis. It sits between the bladder and the rectum. The inner surface is the endometrium. It grows and sheds with each cycle. Around it is the muscular wall. Above are the tubes and the ovaries. Think of a soft, hollow pear. In cross-section, you see 3 layers. Innermost, endometrium. Next, myometrium. Outside, serosa. The cervix opens to the vagina. Ovarian hormones control lining thickness. This lining is where endometrial cancer starts. Cancer cells lose normal growth control. Early growth often stays in the lining and is easier to treat. Cancer starts when some lining cells change. Normal cells grow and die in order. Abnormal cells divide without control. They may form a small cluster or polyp, or spread along the surface. This can take months or years. Extra or irregular bleeding is common early. Unusual discharge can occur. Pelvic pain is another sign. Sometimes there are no symptoms at first. Risk increases with age, higher body weight, and estrogen exposure. PCOS, diabetes, family history, and some medicines add risk. Many with risks never develop cancer. But unusual bleeding after menopause is key. Tell your clinician promptly. They consider your age, health, and risks. Higher risk may mean faster testing. Early detection links to simpler, effective care. Care begins with history and a pelvic exam. Expect questions about bleeding patterns and medicines. The exam checks for tenderness or lumps. A common next test is transvaginal ultrasound. It uses sound waves to measure lining thickness. A thick lining may prompt further testing. Ultrasound is painless and fast for most. The key diagnostic step is endometrial biopsy. A small lining sample is sent to the lab. Microscopy shows if cancer is present and its type. Sometimes doctors look inside with hysteroscopy. If cancer is found, CT or MRI checks for spread. Blood tests help planning but do not diagnose it. Staging often occurs after surgery. Stage describes how deep and how far it has gone. Your team explains results and next steps. Most care follows a clear order of steps. Treatment depends on stage and your health. Surgery is the most common treatment. It usually removes the uterus and cervix. Sometimes ovaries and tubes too. Radiation can target remaining cells. Hormone therapy may slow hormone-sensitive disease. Chemotherapy helps higher stage cases. Found early, outcomes are often excellent. Many early cancers are cured with surgery alone. Follow-up monitors for return. Rehab and support aid recovery. Healthy weight, exercise, and diet support overall health. Manage chronic conditions and know your family history. Keep checkups and report bleeding promptly. Ask about pelvic exam, transvaginal ultrasound, and biopsy if needed. Bring your medicines, symptoms, and family history. Expect clear explanations at every step.